areas of concern? Should people be worried? And if yes, how much? We've also opened our call-in lines for our viewers in case you have any questions. To answer them, we are now joined by Dr. Ishwar Gilada. He is an infectious diseases expert. He's also a Secretary General at the Organized Medicine Academic Guild, OMAG. Dr. Gilada, first question, should we be worried about this latest variant?
See, at present, we don't need to be worried. What we need to do is we should look at our preparedness. Our pandemic preparedness is much better than any time earlier, not even just 3 or 4 years before. So we have enough of medical manpower, enough of oxygen, ICU beds, ventilators, they are in surplus. So secondly, we need to look at the trajectory of the infection. If the trajectory of the infection is just like a flu-like syndrome, comes and goes in 3 to 4 days, no oxygen demand is there, no hospitalization is there, no deaths are there, we don't have to worry. Secondly, we need to be prepared for a vaccine which will work on JN.1. So we need not vaccinate people immediately, but we need to have that preparedness. And it's good that Indian Council of Medical Research or ICMR, they have shared the newer variant with the vaccine manufacturer companies so that they can be prepared for making the new vaccine. However, the government of India will have to order in advance if they need a vaccine. Thirdly, whether it is spreading everywhere or not, the best way to check is a wastewater surveillance. Wastewater surveillance is you check the toilet water at municipal corporation toilet water treating sites. There you don't have to check individuals, you don't have to check families, you check community. So if you find that wastewater contains the virus, because the virus test, RT-PCR, is a very sensitive test. Even if it, 1 or 2 viruses are there, it can be picked up there. In that sense, if we know in advance where it is going to spread, because that will tell you in 10 days in advance. And it is not a new technology, it is a 100-year-old technology that was initially tried for the first time in Ireland to check whether enteric fever or typhoid was spreading or not in the community. And once we are prepared for that, then we can check out the plan. Currently, it is just like a monsoon, which starts from Kerala, then goes in the north. So it is Kerala, Karnataka, Goa, Tamil Nadu and Maharashtra, and then we'll go to north. So the rest of the country should be prepared in advance. We are having a New Year rivalry. We are going to have a Christmas in 10 days. So people should be not be overcrowding, and you should be reverse masking. Like people which are above 60 or which are with comorbidities or on chemotherapy or renal dialysis, they should use masks so that they do not get infected. So as a community, we need to protect them. Whatever immunity we have, there is immunity there. JN.1 has not invaded up till now in a big way because it is a descendant of Omicron 0.4 and 0.5. And in India, because we got already 0.2 in abundance, that did not allow 0.4 and 0.5. So let us check, let us be prepared, but do not panic.
Okay, are the existing vaccines, people who are already vaccinated or might want to get vaccinated now in view of this surge, are the vaccines capable of handling this threat?
No, I'm saying that at present, see, social distancing in country like India are not possible. What is possible is a hand hygiene, and that is an individual check. We cannot check whether somebody is washing hand or not. But what we can check is masking. And masking to be introduced at least for those people which are 60 and plus population and with comorbidities, so that other people do not infect them. So you, at a home, if you have a 60 plus person, that person should wear mask rather than everybody wearing masks. And that is called masking.
So my question was that while these precautions have been in place and now after several years of being acclimatized to COVID threat, people do know what is to be done, but more often than not, these advisories get ignored. So in case somebody wants to get vaccinated, how effective is the current variable of a vaccine that is available in the market against this particular variant?
No, mask, whatever mask you are using, they are good enough. We have learned enough of masking and we have prepared our people. Our problem with our people is that when there is a problem, then we realize that our immunity should be good, we should do yoga, exercise. But when we are healthy, we don't want to look after them. So particularly those people which have bronchial asthma, which are smokers, they should stop smoking. So we try blaming on a virus, but we do not blame ourselves on our habits. So unless and until we look after ourselves, we do some exercises, yoga, etc., we will be having this problem or that problem. The second problem will be diagnostic dilemma, where currently because of winter there are other viruses prevalent. H3N2, H1N1, those are the influenza type A virus, and RSV, respiratory syncytial virus. They are also prevalent, much more prevalent than COVID. And the problem is we cannot diagnose them so easily because the diagnostic tests are very expensive. A lot of people cannot afford that kind of PCR. So therefore, we need to look at whether it is currently this virus is more or that virus is more, and that best way is a best water surveillance, and that we should adopt as early as possible as a national policy.
Okay, stay on with me, Dr. Gilada, because we are also getting information that there are no travel restrictions, either domestic or international, that the authorities are mulling. As of now, no high-level teams are being sent to the state just yet because the authorities say that the situation does not merit any concerted efforts like these. There are just 21 variants that are linked to JN.1. There have been no hospitalizations. But Dr. Gilada, this is winter time, and anyways there is an increase in diseases related to respiration, and winters are setting in. How does one know that the symptoms that the people are reporting are related to COVID and therefore they must go and get themselves tested, specifically for JN.1? Is there any different trajectory that the symptoms take?
See, currently the symptoms what we see are the same as that of earlier COVID variants or subvariants. So it is a upper respiratory tract infection, not involvement of lower respiratory tract, running nose, headache, fever, body ache. Beyond that, nothing much is seen. And whatever deaths have occurred, they were not of JN.1. They were the deaths of earlier COVID variants or subvariants. Secondly, we at present we do not need any kind of restrictions or travel restrictions, because that will kill more people for want of their employment than the COVID virus. So we need to equate that. We need to put restriction only subsequent to what we see on ground. So on the ground, if we see only infections, no deaths, no hospitalization, no oxygen demand, we should wait and watch. Some infections come here to make us immune, and that's what has been done by Omicron. Only after Omicron came, India opened up, because everybody got infected. Thereafter, there was no chance of getting infection. Most of the people got vaccinated, so we had a double immunity, and we opened up. I think we should follow that same strategy. No travel restriction, no kind of restriction on hotels, restaurants, and this thing, only on crowds. And what are we going to lose if we use masks? Because if we know that the virus enters only from this area, just block this area. It's also good to prevent you from current pollution. How much pollution is going on everywhere in Mumbai or Delhi or any city? Well, our AQI is sometimes 350 to 1000. I just returned from Germany, where they say that when AQI goes from 7 to 10, there's alert in Germany. So here AQI is 100 times more than that, and we are still not worried. So if we use masks, we are preventing from many other infections, including tuberculosis as well as the current viral infections. And also pollutants and some kind of irritants which are coming through the AQI air pollutants.
Dr. Gilada, we've got our viewers joining us in on the broadcast. Anita from New Delhi. Ma'am, fire away your query.
I was wondering, I have not heard about COVID on the rise in New Delhi. Is it on the rise?
Ma'am, it's as of now, it is only been reported in southern states. There is Goa that has reported 19 cases specific to JN.1 variant. But Dr. Gilada, that is understandable apprehension now. You said that it starts from the south, comes to the north. Are we going to see a rise in northern states as well?
No. Currently, we need to just wait and watch. The worry should be only for the scientific community and the lab community and INSAGOG. They should make guidelines. The rest of the people should not panic. They should just hear what is happening, headlines, etc. But at the same time, use masks whenever they are going to crowded places, public transports, and when they have elderly people at home, see that they are protected from your behavior.
Right. Prevention, as they always say, should be priority. There is no need to panic as of now. Thank you, Dr. Gilada, for clearing the air for us. We take a very quick break on that note.